In the last week and a half or so, I reckon, there's been so much said about vapes and vaping and how it should and should not work. Eventually, the legislation that was presented to Parliament uh, places the onus of selling vapes on pharmacies. The Pharmacy Guild was pretty quick to come out and say, we weren't consulted, we don't really want to be a part of this. We have tried to contact some of our local pharmacists and they've declined to talk either on an individual or an organisational level with some of the larger pharmacy outlets. So I thought would be worthwhile, while Dr. Bob Thurman's not available, to talk to somebody who has worked in this space for some time. Dr. Colin Mendelsohn, as I mentioned, is a retired academic, a researcher, and a smoking cessation clinician. He's with us. Colin, good morning.
Good morning, Steve.
Can we just start with the legislative changes as someone who's worked in this space and done a lot of thinking and looking at vaping? What do you make of what's been put forward by the federal parliament?
Look, it's novel. It hasn't been tested anywhere. It's controversial. Look, originally the government had this prescription model where the vapers had to go to a doctor, get a prescription, then go to a pharmacy and get their supplies. But less than 10% of vapers were willing to do that. And I think we're going to find that the pharmacy model will also fail. So basically now vapers are required to go to a pharmacy. They'll need a script for 3 months, but after that they go to a pharmacy, have a conversation with the pharmacist, and they will be supplied under certain circumstances with vapes. I don't think vape is going to do that. And the reason is that very few pharmacists are willing to supply these products.
Mm-hmm.
They've said that. And the products that they're providing are very restricted. They're a restricted range of products. The products are unappealing. They have most of the flavours have been taken away. The strengths have been reduced. And I think we're going to find that most smokers and vapers are going to continue to buy their products from the black market.
So you think the black market will continue?
Oh, absolutely. I mean, we know from experience that when you have an established black market selling a product that people really want, no matter how much policing or border control you introduce, the market continues. This is the second biggest illicit drug market in Australia, vapes, and it's not going to go away. When you prohibit something, it just goes underground. We know that from experience. There's no mystery about that. And I think that's going to happen this time as well.
Okay. Colin, part of the legislative reaction to what's been happening is, or a large part of it, I suspect, is about getting the disposable vapes away from children who have taken it up at quite disturbing levels.
Yeah.
So at that level, is any of what's been going on justifiable when it looks at protecting young people from these things?
Look, these products are not for kids. These are adult quitting aids for adult smokers. So that's the first thing. We don't want kids using these products. The best way to prevent kids from accessing these products is to sell them like cigarettes from licensed retail outlets where you have, a retail vendor who is licensed to sell products specifically to adults. And if they break that agreement, they lose their license. What's happening now is that because we've made it so difficult for adults to get vapes, they're all going to the black market. The black market has gone berserk, and the black market sells unregulated, untaxed products freely to young people, and that's where kids are getting their products from. If we made it that they had to go to a licensed retail outlet and we knew who those people were and we were monitoring their sales, then like cigarettes, there would be a limit in the access that young people would have. So if we want to restrict access to young people, we need to license and sell these products like they do in New Zealand, which is working extremely well.
Can you just expand on that? Because you have been writing about the difference of approach between Australia and New Zealand. What is the regime in New Zealand?
Look, New Zealand's had remarkable success. So in 2020, they legalised and regulated vaping products. So they said, we're going to sell these from licensed retail outlets to adult smokers, so kids won't be able to buy them. And since that time, their smoking rate for adults has fallen more than twice as fast as in Australia. They've got no significant organised crime. So people have said, well, we'll go to the vape vendors, the retail outlets. Well, there's no point in going to an organised crime outlet. We'll buy the regulated products from the vape vendors. And there were increases in youth vaping before regulation. Since regulation, it started to level out. So it's containing youth vaping. So they're going to be smoke-free in New Zealand within a couple of years. Australia is way off being smoke-free. So
Mm.
it's been a remarkable success in New Zealand, and
Right.
there's no reason why that shouldn't work in Australia.
So that's part of the policy. Can we talk about the I guess the health side of vapes? And there's a question on the SMS as well. It says, can you ask the doctor about the safety of vaping and ingredients that haven't been tested? So as a smoking cessation clinician, what do
Yeah.
you think of vaping as a way, if we can get the mix right, as a way of stopping people from smoking cigarettes?
Look, vaping is a second line treatment. So ideally, people would use some method to stop smoking, and they wouldn't be vaping. The reality is that many people just can't stop. So vaping, it's the most effective quitting aid we've got. It works more effectively than other treatments, but it's also the most popular. So it has an enormous potential public health benefit. And it does have some risk. Nothing is risk-free, but the risk is very small. It's only a small fraction of the risk of smoking. For example, the risk of cancer from vaping is less than 0.5% of what it is from smoking. And look, there are small risks. There's no question about that. But if the alternative is to smoke, it's a no-brainer.
Okay.
This is only a very tiny fraction of the risk related to smoking.
Is much of the risk with vaping from the flavors?
No, not really. No, the flavors generally look. We may find out there are problems in the future, but the flavors have been around for 20 years, and we're seeing, according to Public Health England, so far no significant concerns. There are certain flavors that we know may be harmful, and they've been banned. But
So
we're
so are
talking
they the
about
ones related to the popcorn lung? I think I've
no popcorn lung is a myth, Steve.
okay.
There has never been a case of popcorn lung from vaping or from smoking, and that's due to a chemical called diacetyl that's used as a flavoring agent. There are hundreds of times greater amounts of diacetyl in cigarettes than in vapes. There has never been a case of popcorn lung from smoking. So it certainly has never been from vaping. It's a myth,
Okay.
and we need to put that to rest. There's a lot of misinformation about vaping, unfortunately. It doesn't cause serious lung disease, which is another commonly stated concern about vaping.
So where to from here do you think we're likely to go, given what we've done in the past? Because there is a concerted push now to rid Australia of vapes generally. I think they were the words similar to that from the health minister. So what do you
Yes.
think the likelihood is then in terms of smoking rates? Because I have heard some young people are now giving up the vapes to go to smoking, in part because they
Exactly.
think it's a healthier alternative,
Yeah.
which is a worry. But we've sort of reached this point now where it's come to a head. What do you think is ahead for us, Colin?
Look, I think vaping is here to stay, whether we like it or not. I mean, we all have our views about vaping, but the reality is people want to vape. Nicotine is beneficial. It does give people pleasure, it relieves anxiety, helps them concentrate, but it's the most effective quitting aid we've got. It works better than nicotine replacement products. It's at least as good as Champix, and it's the most popular quitting aid, so it's going to reach more smokers than anything else. And whether we want people to do it or not, they're going to do it anyway. And overall, I think the benefits are very positive for public health. We don't want kids doing it, and we need to introduce ways to reduce access for young people, but we mustn't get in the way of adults using these products because it's life-saving, and it will prevent enormous amounts of cancer, heart disease, lung disease. So it needs to be available for adults who can't quit. And but the risks I think are very small.
Mm. Given yesterday the rules change and vapes should theoretically be harder to get, there may be people with withdrawal symptoms. Do you fear that they'll turn to cigarettes?
Look, some definitely will. I mean, people have already gone back to smoking. People have said to me, look, I'm so upset by all this, I can't get my vapes easily. I'm just going to go back to smoking. And I've heard a lot of people say that. People are very anxious and angry about all this. Look, there are ways to wean yourself off vapes. Vaping is less addictive than smoking, so it's definitely easier to quit vaping than smoking. But nicotine itself is relatively benign, but it can cause dependence, like caffeine, which can be unpleasant. But it lasts a week or two, and if you gradually reduce your vaping, reduce your concentration of nicotine, replace it slowly with gums and lozenges, most people can quit that way. So there are solutions.
Colin, thanks for your time this morning.
My pleasure. Thank you, Steve.
Dr. Colin Mendelsohn, a retired academic, researcher and a smoking cessation clinician.